Good morning, everyone. My name is Mohammed Saris. I am a general anesthetic dentist here at Mediclinic City Hospital. I've been at the hospital for around 4 years. I'm delighted to join you guys today. I'm hoping that you'll find this webinar useful. The purpose of this webinar today is to hopefully answer all the questions you might have about dental health from a whole body perspective. We'll explore how dental health affects your overall health, tips to keep your teeth healthy and strong, and ways to maintain a good oral hygiene. If you go to the next slide, please, Vina. Right, so why dental health is important? Dental health, it doesn't only give you a great smile, but it's also essential for your overall health and well-being. We will touch on that during the webinar. Good oral health really improves your quality of life. Sounds like a big statement, but it really does. Right, so the benefits of maintaining a good oral health. Gum disease, which is very common amongst most people, can be linked to a variety of health issues such as stroke, heart disease, and diabetes. Maintaining a good oral health prevents bad breath, which a lot of people suffer from. It also maintains strong, healthy teeth, which is essential for a beautiful smile and also for maintaining function. So with strong teeth, we can chew, we can bite, we can digest the food properly, and this has a lot of benefits. Also, prevention is key. So if we look after our teeth and gums and prevent problems, then that prevents us a lot of pain and costly dental treatment as well. Right, so I'm going to touch on the dental health and the heart. This subject has been a matter of a lot of research over the last few years. The inflammation caused by gum disease can potentially damage the blood vessels in the heart, and this will increase the risk of heart attacks and strokes. Now, this topic is a subject of ongoing research, but the link has been studied very closely, and people with inflamed gums tend to get a lot of bad bacteria into the bloodstream, and this bad bacteria can potentially reach the heart and cause a lot of problems. So it's something that we really need to be aware of, and that should encourage us all to look after our gums. Diabetes is one of those common diseases as well, especially in this part of the world. People with diabetes have a higher risk of gum disease if the sugar levels are not controlled adequately. High sugar levels weakens the immune system, making it more difficult to fight off infections. So diabetes, what diabetes does really is that it also prevents healing of the gums. So if you have uncontrolled diabetes or your sugar levels are generally high and you have gum issues, then the treatment of gum problems can become very difficult. Untreated infections of the gum can lead to the bone loss around the teeth, and we all need the bone around our teeth to keep the teeth in place. So we do see people with uncontrolled diabetes suffer a lot from gum disease, and they tend to lose their teeth fairly at an earlier stage in their life. So it's very important to understand the risk between uncontrolled diabetes and gum disease. People with controlled diabetes, controlled sugar levels, tend to show same results as people with no diabetes. So controlling the sugar level here is extremely important. Dental health and pregnancy. Pregnancy increases the risk of gum disease. A lot of pregnant women report to us complaining of bleeding gums. Some of them, 30% of them, develop localized big infections in the gum. And this is because hormonal changes during pregnancy can make the gums more sensitive and prone to inflammation. If left untreated, obviously gum infection can increase the risk of premature birth and birth weight. So it's something that we also need to be aware of. It's important that anybody who's planning to become pregnant, to get a dental checkup, dental screening, get all the treatment done, and the gums healthy before planning to become pregnant. Because again, bad bacteria can enter the bloodstream, and this can cause a range of problems. If a pregnant person is having dental problems, we try and avoid doing the treatment in the first trimester. We try and push it to the second trimester because generally this is accepted as the safer time to do any treatment. But obviously, again, prevention is very important. So screening before planning to have a baby is very important. Right, so you are what you eat. I think this is very common. We all understand this. It's important to remember that the mouth is the entry to your gut. The oral health status is a pretty good indicator of how the rest of the gut looks. So if you clearly, if your sugar level, sugar intake is high, your acidic intake is very high, that is going to reflect on your gut, on your digestive system, and it will cause a lot of problems. So it's very important to be aware of this. Right, so nutrition and dental health. So what you eat and how active you are have a significant effect on your overall health, including dental health. A balanced diet helps to maintain healthy and strong teeth and gums. Vitamins and minerals such as calcium, vitamin D, phosphorus, and fluoride are important for healthy teeth and gums. The acidic and sugary foods and drinks are really bad. We try and limit the intake of these of this type of food. It contributes to decay and erosion of your teeth. It can lead to a lot of cavities and sensitivity in the teeth. Water, on the other hand, is very important. It can help to rinse away acids, remaining food particles, and bacteria. And high fiber content promotes scrubbing of the teeth, which helps to clean, obviously, the teeth. And also it promotes saliva production, which neutralizes acids. We'll touch on this a little bit more later in the other slide, but it's dental health is really closely related to the rest of the body. So what you eat can not only affect your teeth, but it will also affect your general well-being. Right. So minerals and vitamins such as vitamin D or minerals like calcium, fluoride, phosphorus are all important. Calcium is essential for building healthy teeth and bones. It's found in dairy products such as cheese. Vitamin D is essential in absorption of calcium, and you generally find this in fatty fish such as salmon and tuna. Fluoride, it's well documented, helps prevent tooth decay, and find that in toothpaste and water. I don't think the water here in UAE is fluoridated, but in some parts of the world, the water is fluoridated. And phosphorus is also maintained in building strong teeth, and you can find this in fish, things like fish, poultry, nuts, and beans. So exercise. Exercise, obviously we all know how important exercise is for our general well-being, but it also helps in maintaining a good dental health. Generally, people that exercise and look after themselves will tend to develop or have lesser chance of developing teeth problems. And this makes sense. People that look after themselves and exercise will tend to eat better, eat the right things, look after themselves, feel good. So they will look after their teeth, will brush more often, less chance of developing decay because of less sugar intake. Research shows that people that do exercise at least 3 times a week have at least 30% lower risk of developing periodontitis. Periodontitis is a severe form of gum disease where you start to lose the bone around your teeth, which can potentially make you lose your teeth because the teeth become loose and could eventually fall out. Exercise improves circulation, so of the blood circulating around the body also flows to the gums, brings in all the nutrients that your gums need and the teeth. So that helps. Exercise reduces stress. So if you're less stressed, you're less likely to grind your teeth during sleep. This is something that we see a lot here. It's increasingly becoming very common. People tend to go through phases of stress. It can manifest itself in the teeth. So people complain. They come to us complaining of waking up with headaches, joint problems, problems in the muscles of the jaw, and you start to see evidence of tooth wear. So the teeth start to wear down in certain areas, and that could potentially have harmful effects on the teeth. The more wear that happens to the teeth, the higher the risk there is on developing problems. So the teeth could potentially become chronically sensitive. The nerves of the teeth can get really affected, and you could potentially need a lot of complicated dental treatment that can compromise the teeth in the long run. So it's important to seek your dentist if you feel or you have or you've become aware that you do grind your teeth. Exercise also promotes healthy guts and digestion. We touched on this. People that tend to exercise tend to have better diets, and also exercise, helps in digestion, which breaks down the food and releases nutrients needed for healthy teeth and gums. So, right. So, what can we do? Simple steps to that will help us to maintain a good oral health. I always say that prevention is cheap. Prevention, if you spot problems early, if you look after your teeth and gums, if you visit the dentist regularly, then any problems that might be there can be spotted early. This means the treatment could potentially be less complicated, cost less visits, less hassle for the patient. So it's very important to try and prevent dental problems from happening, as well as obviously the benefits of keeping your teeth strong and healthy. And the moment you start working on a tooth, the chances this tooth is not going to last a lifetime. So if we can avoid any treatment on the teeth, and that's by prevention of problems developing in the first place, that is definitely the best way forward. Simple things to do: brushing. You guys will all know this. Brushing for 2 minutes twice per day is a must. But not any brushing. It's important that the brushing itself is quite effective. We want to get to all the areas where the plaque or the fluid might be stuck. So it's very important to be aware of what we are doing with the toothbrush. Some people will prefer to move away from a manual toothbrush to an electric toothbrush, and that's also helpful. So any form of brushing is good, as long as we're getting to all the areas and we're giving it enough time, then we're doing a good job. Cleaning in between the teeth is very important. A lot of people miss cleaning in between the teeth. The toothbrush, whether it's manual or the electric, will will not get into between the teeth effectively. So it's important that we do put the effort and try and get in between the teeth. Most problems in the teeth happen on the surfaces that are in between. So most decay that we see in the teeth, especially the back teeth, happens in the in between the teeth, on this where the teeth contact each other. So that's where food mostly gets stuck, and if we don't floss or we don't get in between the teeth, we're less likely to remove that plaque of food, and could potentially end up with problems in the teeth, as well as obviously halitosis, giving us bad breath and stuff. So it's very important to clean in between the teeth. Floss, I know a lot of people complain about floss. It's not easy to use, but there's a lot of videos that you can access that shows the right technique for flossing. It's pretty easy once you get into it. Any type of floss will do. Flavored, not flavored, tape, thin floss, any floss will do. It's particularly important as well if you've got dental fillings and restorations and bridges as well. So or dental implants. If we don't keep these restorations healthy, they will fail. And failing means more treatment, more pain, more complications. So it's very simple. Try and get in between the teeth. That will really, really help. If you're not using floss, you can get those little small dental brushes, interdental brushes. There's a lot of brands on the market. You can choose what's best for you. You can have that discussion with your dentist, but they're really, really helpful as well. Really, really helpful. Water jet, a lot of people like using water jet. This flushes the areas that are difficult to get to, releases water under pressure, with force under pressure, so it really flushes out. So and a lot of people, I don't personally use it, but I prefer the interdental brushes, but a lot of my patients use water jet, and they see a lot of benefits. Regular dental checks. It's very important to try and develop a habit from a young age to see the dentist on regular basis. We recommend 6-month intervals. Sometimes we would need to increase the frequency of the visits if we feel that maybe the patient is at a higher risk of developing problems. Regular checks will allow us to spot problems early, reinforces good habits. If there's any problems, they can be treated while they're at the beginning stage. So it's better for the tooth, it's better for the gums, it's and less likely to have to develop complications. Oral cancer screening as well. Oral cancer, unfortunately, is one of those things that is on the rise. So getting yourself checked every 6 months also allows for the screening for this, as well as other benefits as well. So and diet control. If you look after yourself, you exercise, you eat the right things, avoid the bad things, particularly acidic and sugary intake, that will really reduce the risk of you developing problems. Avoid brushing straight after eating any acidic or sugary intake. Wait for at least 30 minutes. That's because the enamel tends to be quite soft. So if we brush, then we're likely to wear that enamel. So try and wait for 30 minutes or drink a lot of water. Water helps to neutralize the acidity. Right. Toothbrush and toothpaste selection. So any toothbrush in the market, to be honest, works really well. I recommend to my patients soft to the medium or the medium bristles with a comfortable grip. Doesn't have to be anything fancy. Anything that you're comfortable with will do the job. If you're using an electric toothbrush, a circular head is better, according to research. Toothpaste containing use a toothpaste containing fluoride, which helps to prevent cavities, or contains hydroxyapatite that rebuilds tooth structure. So watch out for these two products or two minerals, and ideally check for the American Dental Association seal of approval as well. Again, it doesn't have to be a fancy toothpaste. It's got to have, in my opinion, it's got to have fluoride. maybe at least 1500 parts per million, then you should be okay. Brush in between the teeth using floss, interdental brushes, or water jet. Some people like to use the more natural replacements. There isn't really a lot of research or to support natural toothpaste. Generally, the effects of using toothpaste and it needs to be monitored over a long period. So I'm not against people preferring to use products that don't have fluoride, but fluoride is well documented that it does help prevent cavities. Miswak is a product from there's a specific tree. I can't remember the name of the tree, but it's quite common in the Muslim world. It's a natural replacement. It's got antiviral, antibacterial, antifungal properties. You can use this to support your brushing as well, if you're looking for a natural option. And just make sure you replace your brush every 3-4 months, because the bristles wear off and it's time to get a new one. Brushing technique, I'm sure you're all aware of this. Apply a pea-sized amount of the toothpaste on the brush. Try and angle the toothbrush 45 degrees angle to your teeth, pointing towards the gum. So get the toothbrush on the neck of the tooth where the gum meets the tooth. Gentle circular motion, on the front of the teeth and the back of the teeth. Don't forget the biting surfaces of the back teeth as well. If you could, another way, instead of going in circular motion, you place the toothbrush head on where the tooth meets the gum, and you can scrape downwards if you're on the top teeth. If you are on the bottom teeth, you can scrape upwards. The reason is that gentle, the circular motion, if we're not careful, it can really result in gum recession, where you traumatize your gums and then the gum starts to recede, and that can cause sensitivity of the teeth in the long run. So definitely avoid heavy brushing, heavy scrubbing of the teeth, because it's very common now to see people with gum recession. Don't forget to brush your tongue, spit the excess of the toothpaste, clean your brush, and obviously don't forget the interdental cleaning as well. Interdental means in between the teeth. Right, so a brief summary of what we spoke about. Oral health is closely connected to your body health. If you look after your body health, then you're generally good with oral health, and vice versa as well. Poor oral health contributes to a range of health problems that we spoke about. Good oral health improves quality of life. You really need to think about the future when we try and keep the teeth for as long as possible. It's important that we are able to digest our food and break down our food. A lot of people with no teeth really struggle with this, and that really can cause a lot of problems later in life. We touched on the importance of brushing twice a day, flossing, regular checkups, the balanced diet and exercise, and always remember that prevention is really cheap. Visits twice a year to the dentist. Minimal treatment really doesn't cost, or the cost is in comparison to heavy dental treatment is very minimal. So if you look after your teeth and gums, then you're unlikely to need heavy, complicated, expensive dental treatment. Thank you for listening, and I'm happy to take any questions. If there's any. Over to you, Vina.
Yes, doctor, I'll read out the questions. When do you usually suggest scaling? Does it affect the enamel? That is the first part of the question.
Can you repeat that again? Sorry, I just didn't get the first part.
When would you suggest doing a scaling, like scaling and polishing? What is the duration where we have to do it? And does it affect the enamel of the teeth?
Right, so scaling, you're basically removing the tartar buildup, the calculus buildup on the teeth. So if it's done properly, it will not affect the enamel at all, and it shouldn't do, because you're not scraping the enamel, you're scraping the deposits that are on the enamel of the teeth. The We tend to recommend doing that every time you see the like on your regular checkups. The reason being is that most people start to develop or get the buildup of tartar or calculus probably a week or two after doing the cleaning. So now having a little bit of tartar and calculus on the teeth or on the gums is not always a problem, but if it builds up a lot, it starts to cause a lot of gum infections, and if untreated, it really can cause a lot of preventable problems. So I would recommend doing it at every regular checkup that you get, which ideally is twice a year. The dentist then might, if depends on the status, might recommend doing cleaning every 3 months. But no, it should not affect the enamel. You're merely just removing the deposits on the teeth. I definitely recommend it. Especially if you notice that your gums are starting to bleed quite a lot, that means there is a chronic infection, and most likely you are needing, it's time to do a scale and polish.
Understood. So, Doc, taking the second part of the question, is there any limited lifespan for RCT? That is, do I need to redo my RCT after a period?
Right. So no, root canal. You don't have to do the root canals again unless a problem develops in these root canals. So the reason you did the root canal is because there was an infection in the tooth, which developed and it reached the pulp where the nerve is, and potentially it caused an abscess in the bone as well. So we do the root canals to get rid of this infection. This root canal then needs to be monitored because it can fail with no symptoms. Now, if it fails with no symptoms, you're not going to be aware of it, but it can only be spotted during examination or regular x-rays as well. If a problem does develop, then it needs to be fixed, whether you have symptoms or no symptoms. If you have symptoms, of course, you're going to try and do it again. The dentist will try and attempt to do it again to clear off the infection again. If there is no symptoms, then but there is an obvious problem that showed up on an x-ray that suggests that the root canal has failed. Yes, it's important to try and do it again, because that infection, although it's not causing any pain, but it's actually eating your bone away, and that can cause a lot of other complicated problems that are not needed. Now, whether if you do have problems, whether doing the root canal again is the only option, then sometimes thinking about other options might be the best approach as well. So it all depends on the situation at the time. But no, if there's no symptoms and if there's no problems with the root canal, then you don't have to do the root canal again.
Doc, next question is, how can we prevent a dentist from making a filling in a healthy tooth? Do we check it with a second dentist to see? So possibly the question is, what is like when a patient goes to any doctor, because himself, he would not have visibility, what is the current condition of the tooth, the doctor may end up, filling a healthy tooth, which necessarily doesn't need a filling. So what is the right process that we do the due diligence, the treatment is right?
Yeah, I mean, I think that this is one of the most common questions as well. A lot of people obviously just complain about this. They feel, especially they feel a lot of the dentistry that has been done on their teeth was unnecessary. Now, you don't always have to have symptoms or pain for you to have problems in your teeth. Sometimes the pain only develops when the problem is too late. So it is important to do check with your dentist every 6 months. Now, if you do go to the dentist and you end up with a big treatment plan and you're not really having any problems, I do understand that this can cause a concern. So what I would suggest, if you're not fully trusting of that dentist, or then there's no harm in seeking another opinion as well. Take a copy of the X-rays if they were taken, and seek another dentist and just seek some reassurance. I think dentists, just like any other profession as well, patients trust the dentist, and the dentist should be up to this. I would suggest that you seek recommendations, ask your friends and families for dentists that they've been to and feel that they trust, and maybe this is the best approach. But certainly, I mean, if you're not having any problems and you are given this big expensive treatment plan, and not only about the cost, but you're concerned that the teeth are getting treated and they don't actually need treatment, then seeking a second opinion is best, and that's very common. That happens all the time. So I think that's fair enough. But as I said, you don't have to have problems. You don't have to have pain to have dental problems. So and this is where the problem is, because the patients feel, okay, well, I'm not having pain from this, and the dentist wants to do it. The problem is that if you don't do it, and you start to develop problems, you'll find that had it been treated, it would have been a simpler issue. And now it becomes a more complicated, where the nerve is potentially involved. And then we went maybe from the option of doing a small filling to a root canal, and and so on. So yeah, a tricky one. But if you're concerned, go and get a second opinion. Okay.
Yeah, so going to the next question, Doc, what are the health hazards from chemical composition of dental floss? So, Doc, I would want if you can touch base on for a dental floss, what is the quality should anyone look at? And if the quality is not apt, does it have any kind of a hazard to the tooth?
True. Yeah, I mean, dental floss is really just, it's, in my opinion, there's absolutely no risks in the tooth at all. If anything, the risk is on the gum, because if you misuse it, most products now, from the trusted brands in the market, will be safe to use. It's really just a tool to try and get in between the teeth and remove the plaque and the buildup that is left after a meal. So it should really have no harmful effect at all on the teeth, because you're not, the floss will not damage the tooth at all. If anything, it will keep the tooth surface clean. The misuse of floss can damage your gums. So if that can do, the gums can get ulcerated. You can cut your gum, and if the technique is wrong and you keep using the bad technique, then you could eventually end up with gum recession around the tooth. So it's important that we use it properly. As I said, there's a lot of videos that you can watch on YouTube that shows you the right technique to floss. I would trust all the good brands that are on the market. I don't see any problems. It's really just a tool to try and get you in between the teeth and just remove the mechanical removal of that plaque is what matters here. So if you're not keen on the floss, I like those interdental brushes. Again, they come in a lot of different sizes, so you can get a selection of sizes and try them, and they're extremely helpful as well. They're extremely helpful. I hope that answers the question. Yeah.
Yes. Doc, how to avoid nowadays? There are a lot of people who would want a crystal clear white teeth, and there are a lot of treatments, cosmetic treatments done for that. Now, two questions I would want to ask about it. One is, how can someone avoid a yellow shade to come on the teeth? And second is, does all kind of these cosmetic treatments for a crystal clear white teeth, is there any harmful effects on a later date?
Right. Okay. So with regards to question one, staining will happen to all of us, staining of teeth. That's something that I think it'll be very difficult to avoid, because staining is mainly a result of things that we eat and we drink. Heavy coffee, tea consumption, there's staining chemicals in foods, red wine consumption, things like that can really stain our teeth after a period of time. To try and minimize this, you're either going to have to cut off these the intake of these products, or try and just be conscious of maybe rinsing your mouth with water after you consume something that could particularly stain your teeth, and that will help to minimize its effects. But generally speaking, most people will end up with discolored teeth. Now, discoloration is two types, or the staining is two types. It can be superficial, so it's on the outside surface, and that can be easily removed once you get maybe a polish at the dentist, or you're careful with brushing at home. The deep intrinsic staining, which happens over a long period of time, most of us will end up with this because, as I said, things that we eat and drink will eventually cause our teeth to stain. So you can minimize it by cutting down on consumption of these products, but it's unlikely that you'll be able to maintain the beautiful white teeth that you had as a child all the way to later in life. Now, with regards to the cosmetic treatment, I feel that maybe you're referring to teeth whitening or possibly veneers, ceramic veneers that we see a lot in Dubai. I am not against doing teeth whitening. Teeth whitening is a simple, effective procedure to whiten our teeth. So if you feel your teeth are discolored, and that discoloration is intrinsic and deep, where cleaning and polishing will not help, then teeth whitening is not a bad option. People tend to ask, does this wear down our enamel? Does it make our teeth sensitive? In my opinion, it doesn't. Basically, it flows inside the tooth. Our enamel, which is the outer surface, is made of cylinders, like tubes. And inside these tubes, you get these staining products that are basically stuck. So this whitening material will flow into these tubes and break down these products. And that lightens the tooth up. But it doesn't really whiten, wear down your enamel. Now, if you overdo it, that can cause long-term sensitivity. Generally, you'll have sensitivity during the whitening procedure, and that tends to go away. If your teeth are sensitive in the first place and you do whitening, then you might struggle quite a bit and get a lot more sensitivity than usual. But sensitivity tends to go away. But if you overdo it, then you might end up with long-term problems, particularly sensitivity. And if you're whitening your teeth and you still consume the products that stain teeth, like coffee and that, then your teeth will really stain badly as well. So we recommend that during the treatment you avoid these products completely, and generally speaking, try and cut down as well. Now, the other cosmetic procedure that is generally done to maybe give you that permanent white teeth, and we see a lot in Dubai, is veneers, dental veneers, or the Hollywood smile, which is a very inaccurate name for it. So veneers basically are a ceramic, thin wafer of ceramic that is glued onto your teeth. I tend to not recommend this in most cases. There is a place and a time for it, and I think it can improve. It can improve in some situations, but unfortunately, most people don't actually need it, and particularly with the people that don't have any issues with their teeth whatsoever. If you feel you want to do this purely because your teeth are discolored, then I will always recommend getting a good polish and get your teeth whitened in the first instance. Ceramic veneers is quite heavy treatment just to improve the color of the teeth. Now, veneers can be helpful if you've got discrepancy in the size and the shape of your teeth, which makes your smile not ideal, or makes you conscious of your smile, makes you very wary of it, really affects you socially. You're really concerned about it. Then veneers can be helpful in optimizing the smile and make you feel better about yourself. Also, where teeth have got, for example, a lot of fillings, and those fillings are starting to show in the front teeth and they're getting discolored and starting to look a little bit unsightly, then veneers can mask and help to cover the fillings and give you that smile that you're after. So I'm not totally against veneers, but I'm against the way it's done in most cases. A lot of people don't actually need it, but in certain cases it really can improve how somebody feels about themselves, and it's got to be done properly. It's got to be planned properly. We tend to plan the end before we start, so then we work backwards, so we know that what the end result is gonna be before we actually do it. And also we always try and be as conservative as possible with this treatment, because nothing in dentistry lasts, and eventually the last thing you want to do is to do a treatment like this and then affect other parts of the mouth as well. So it needs to be planned carefully, and it needs to be done properly as well. Does this answer maybe your question, Bina?
Yes, Doc. So going to the next question, Doc. Fluoride generally is said to be very good for teeth. In fact, even kids go for fluoride treatments. But most of the commercial toothpaste, which contains very high amount of fluoride, which could be bad if consumed. What is your thoughts about it?
Yeah, I mean, fluoride has become a matter of debate over the last few years as well, because fluoride in high amounts is toxic. There's no doubt about this, but it's very well documented and very well researched that fluoride does prevent cavities, providing that obviously you've got the right diet and you're looking after your teeth as well, getting in between the teeth. Fluoride really helps to strengthen the enamel. If there is little lesions developing in the enamel, it can help to remineralize as well the enamel. So from a dental or medical perspective, it's the effects, the benefits on the teeth are definitely there. The reason we recommend that you spit the excess of the toothpaste and you don't swallow it, especially when it comes to kids, and that is to prevent the excess consumption of fluoride, which can then be harmful. But generally speaking, if you're using the toothpaste as normal and how you should be using it, then really there is no harmful effects on your teeth or gums or your whole body well-being. I am an advocate of fluoride. I don't see any problem. I use it. My kids use it. I don't have any problems with it. I know some people will disagree, but obviously it's a matter of choice. Is that okay?
Yeah, absolutely. Doc, again, it's a very big, very important question. I feel it's about the apple cider vinegar, because there are two perspectives to it. From a physical health, there is nutrition. Apple cider vinegar is something which is educated for weight loss, for diabetes, but it has a side effect on the tooth and the bone. So what is your thought process? If it needs to be taken, how should it be taken?
To be honest, it's not something that I tend to recommend to patients. I think the effects on the teeth will be more to do with the erosion of the enamel If it's anything acidic will eventually soften the enamel, which can promote cavities to form, and it certainly after a long-term usage could make your teeth sensitive as well. So just like anything else, I would recommend that for even people that consume a lot of acidic, fruity juices and that, I tend to recommend that they consume that using the using a straw. So the liquid is not rubbing against your teeth, and drink water straight after. Try and rinse your mouth to reduce the effects of this on the teeth. With the effects on the bone and that, I'm not really very well aware regarding this, but I think with regards to the teeth, if you have to consume it, then maybe use a straw and try and rinse your mouth afterwards. Does that answer your question?
Yeah, absolutely. Going to the next question, Doc, is that recommended to use 2 different toothpaste, one in the morning and one in the night? Like, do you think that the content has to be looked at, and what used to be used in the morning, there should be a different content before sleep?
No, again, it's not something that I would recommend. Just get yourself a toothpaste that you're comfortable with, that's got the right amount of fluoride that you like the taste of, and you can easily use the same toothpaste twice a day. The times I tend to recommend maybe using a different toothpaste or a combination of the two during the week is if I want something specific, maybe for gum issues. So there's a certain toothpaste that I would recommend for treating gum problems, and there's another toothpaste that I'd recommend to treat sensitive teeth. So maybe a combination of both, not at the same time, but maybe one in the morning, one in the evening, or 2 days of this, 3 days of that. Then that's the only time I'd recommend using 2 different toothpaste. But if you are just after a toothpaste that will give you the fluoride that you need, and you don't have any specific dental problems or gum problems, then I think just using the same toothpaste twice a day is fine. No harm in changing the toothpaste after maybe a month or 2 if you feel that tooth is starting to develop. If you feel that your teeth are starting to develop problems or sensitivity, because some toothpaste can be quite abrasive. So I would try and avoid that. If you feel that toothpaste is helping you in terms of keeping your teeth white, but then your teeth are starting to feel a little bit sensitive, then it's probably time to change to a different toothpaste. But generally speaking, no, using the same toothpaste twice a day is fine. Is that okay? Veena? Thanks, team. I cannot hear you now, Veena.
Yeah, sorry. Doc,
Sorry.
my question was that going back to again the tooth whitening part of it, do you think it is really required other than the cosmetic part of it? Does it have any medical effects also?
No, teeth whitening toothpastes will have a limited effect on the teeth. If you've got superficial staining, it'll probably help remove that staining. The problem with that, though, is that they are actually quite abrasive. So after a long-term usage, your teeth will start to feel sensitive. So generally speaking, I'm not a big fan of whitening toothpastes, but it is available in markets and a lot of people use it. You do get now brands where you get a teeth whitening effect and sensitivity reduction effect. So possibly try a toothpaste like that. But the only way that toothpaste can really remove this, help you in maintaining white teeth, is by the abrasive component of it. And research shows that with time, that is you are at a higher risk of developing sensitivity because you're wearing your enamel down. So if you're fine and happy with the color of your teeth, then I would just avoid a whitening toothpaste. And that's just my recommendation. That's just how I feel about it.
Doc, is it possible to treat tooth recession?
Yes, tooth recession. There's many ways of treating tooth recession, but the most important thing is to understand why the recession actually happened in the first place, because it has a lot of reasons. Now, if generally gum recession means that the gum has pulled away from the tooth, because the bone that was on the tooth has come down as well. So the bone in that area where the recession happened has been lost. So the gum then follows the bone down as well. Or in the case of the upper teeth, then it's gone up. So we need to understand why this has happened. Now, if it's gum disease and chronic gum infections can lead to bone loss. So a lot of people then the gums recede as a result of gum disease. So we need to make sure that the gums are healthy and stable and stabilize the gum situation and make sure that the gum disease doesn't come back again in its severe form. So this issue of recession doesn't happen. If the recession is a result of trauma to the gums, like bad technique of flossing or heavy-handed brushing, for example, so we need to also avoid this to make sure that it doesn't happen to the rest of the teeth. Orthodontic treatment can cause gum recession because you're moving the tooth, and that can cause a little bit of bone loss in certain areas. That also can lead to gum recession. So the first important part is to try and make sure what the reason for tooth recession and why it's happened. Now, treatment of gum recession, assuming that it's a result of maybe heavy-handed brushing or orthodontic treatment, that part of the tooth that is exposed now is the root of the tooth, and the root of the tooth does not have enamel, and that surface is very close to the nerve. That's why teeth become sensitive. So if the teeth are not sensitive and the recession is mild, I personally have no problems in keeping an eye on it. We don't have to do anything. If recession is worse and the tooth starts to develop sensitivity, which might do with time, then we have options. We always try and keep the treatment option minimal. So in first instance, the root surface that is exposed, we can cover it with a white filling material. There's no drilling really in this procedure. It's very straightforward, but it covers the root surface that was exposed. So that makes the tooth less sensitive, and it protects that surface from maybe developing problems as well. Those fillings with time will probably discolor or they will come off the tooth, so it might need to be done again. But this is the simplest way of treating gum recession. If the recession is minimal, and what we could try first is maybe a toothpaste that helps with sensitivity of the teeth. Gentle brushing using a sensitive toothpaste can help maybe eliminate the sensitivity. If not, we can move on to the option, as I said, of putting a white filling material. If the problem is severe and it's worse and it's quite generalized, then the option of gum grafts. There's surgical procedures where you take a little bit of gum from elsewhere in the mouth and then you can layer it on top of the exposed part of the teeth. This is something that can be done by periodontists, and we do it here in the hospital as well. So, but as I said, if the problem is mild and it's not really causing any problems, it's always best to try the simplest options first. The less we can do to the teeth is better, and try and prevent the problems from happening in the first place. And if they do happen, how to try and stabilize it quickly and avoid complicated treatment. Does that answer your question? Yeah.
Yes. Doc, what is gum regeneration technology? Is there a technology being developed for gum regeneration?
There is no really there's no such thing as gum regeneration, as far as I'm aware, to be honest. The gum, you don't lose gum, you lose the bone around the teeth. So as I said, if the gum recedes in that, you can do gum grafts. There's bone reservation. So if you're losing bone around your teeth, we can try and stabilize that. But certainly, if you lose bone, you cannot bring the bone itself will not lay down new bone, or you cannot, if you lose height, for example, around your teeth, you're not going to be able to add height and replace the bone that is lost, but you can stabilize, you can try and preserve the bone that is left. But gum regeneration, I am not aware of this, to be honest. I don't think you can regenerate the gum. If it recedes or it's inflamed, and that there's a way to treat that, but you cannot regenerate gum.
Doc, how to prevent the receding gum lines?
Right. So So touching on this again, so the gums recede, as I said, for a variety of reasons. So gum disease that is left untreated will result in the bone being lost around the teeth, and this will let the gum drop. So the root surface then becomes exposed. So this is what you call a receding gum line. This can be localized in one area if the infection is there, or it can be generalized if you're suffering from a generalized gum disease. Another reason why the receding line might change is, as I said, trauma as a result maybe of bad technique of flossing or brushing. So heavy-handed brushing is very common in people. That can traumatize the gums, and the gums recede, again exposing the root surface. Orthodontic treatment can cause gum recession as well, especially in people with thin gums. Some people have thick gums, so unlikely to have gum recession as a result of orthodontic treatment, but people with thinner gums tend to develop gum recession. People that clench and grind a lot at night can also develop some gum recession. So yeah, there's many reasons why the gums tend to recede. Most of us will have receding gums as we grow older. It's also a natural physiological process that tends to happen with time, because we will all lose a little bit of bone around our teeth as we get older, so the gums will recede. But it's particularly concerning when it's happening at a younger age, and there will be a main reason for it, and the reasons that I touched on. Hope that answered the question.
Doc.
Yes.
It's a personal question. Like, Doc, I have done my root canal 7 years back. Should I get it done? I think you answered this question already, that what is the time period? It can be just checked by the doctor, right?
Yeah, just check it. These things should be checked routinely. Maybe once a year, once every 2 years, just get an x-ray, make sure that the root canal hasn't failed. Because as I said, the root canal filling can fail and you don't have to have symptoms. But if it does fail, then the chances are it might cause the bone around the tip of the root to be resorbing away. So it's very important to monitor the treatment and get regular x-rays done. Not very often, but once in a while, get an x-ray done just to keep an eye on it. But if there's no symptoms, and also there's no actual problems, then you don't need to do a root canal again.
While answering one of the question, Doc, you said that you do not rinse the toothpaste after brushing. So we don't rinse out the leftover of toothpaste after brushing. So it will be leftover, right? The toothpaste will remain there.
You spit out the excess. So you're not going to have much of the toothpaste left. It's just that it allows it to take effect. So that's the recommendation, is to try not to is to just spit out the excess and try not to rinse your mouth straight after, at least.
Okay, so the logic behind is whatever is the benefit, let it be fluoride or we say calcium, whatever is the content, let it be absorbed into the tooth.
Just give it a chance. Just to give it a chance.
And maybe if someone is not very comfortable not rinsing, maybe they can wait for 5-10 minutes and then rinse.
I mean, by that time it's gone anyway. But you know, look, as if you rinse your mouth, you lose out on the effects of the fluoride, but that's not a big deal if you are actually looking after your teeth anyway. So you know, one of the main purposes of brushing, and that is to remove the harmful stuff that are leftovers away, the physical removal of these things away from the teeth and the gums. So if you're not getting the benefits of the fluoride, at least you are still removing the harmful products that you might need, that might affect the teeth, and then you might need fluoride for. So if you are removing these products, you're still doing a good job.
Doc, what is your thought about the mouthwashes like Listerine, other mouthwashes? What is your thought process?
I mean, I have no problems with people as well using mouthwashes. I would maybe avoid the ones that are alcohol based, because a lot of people report bad breath as a result of these ones. But I have no problems. It makes you feel good about yourself, then use it. The specific mouthwashes that are designed to fight gum diseases and inflammation of the gums, then I recommend them all the time. The other ones that purely just gives you makes you feel good about yourself and gives you a nice breath, then I have no problems of you using that. But that is not going to be a replacement to the actual physical removal of the plaque and the food particles. So you still need to brush your teeth. It's as I said, the mechanical removal of these things that is very important.
Doc, going back to the floss, the question related to floss again, if someone accidentally swallows the content of the floss or the floss by itself, do you think there is any hazard in that or after effect?
No, I don't think there's any problems. But I mean, flossing itself, it's like a tape, so it's unlikely that you're going to swallow it. If that floss is getting stuck in between your teeth and you're finding difficulty to remove it, then there's something wrong in between the teeth. It's either a bad filling, or there's a cavity, or maybe a certain type of restoration that you've done where the floss is catching. But it's unlikely that you will easily swallow a piece of floss. So if it is getting stuck, you definitely need to get checked why this floss is getting checked. It could be the technique that needs to be worked on, or the chances are maybe there's a filling or another type of restoration that is not sitting properly on the tooth and the floss is getting stuck. But if you accidentally, I think, swallow a little bit of a tiny thread of floss, I don't see that causing major problems.
Doc, it's next question is related to wisdom tooth. So after removal of wisdom tooth, how long should we wait to think of fixing or replacing with a permanent tooth?
Repeat that again. Losing a wisdom tooth and replacing that with a permanent tooth.
Yeah. So after removal of a wisdom tooth, how long should we wait to think of fixing it with replacing with permanent tooth?
Right. Okay. So generally, losing teeth, if you want to, if the recommendation is to replace that missing tooth, ideally you want to do it within the first 3 months. The reason being is that once you remove a tooth, you start to lose the bone in that area, and for an implant to sit properly, you need all the bone that you can have around it. So before you have a tooth removed, have that discussion with the dentist, and if the plan is to eventually replace that tooth that you've taken out, it's best to do it as soon as possible. That doesn't mean that you cannot have implants later, but it does complicate the the problems, it complicates the treatment. Particularly, for example, on the top, where if you lose a tooth and you lose bone, that bone surface then can become quite close to your sinuses. So if you then decided to have an implant done, then there might not be much bone left to actually put the implant, and then you will resort to more complicated treatments to try and increase the height of the bone before you put an implant. Now, wisdom teeth, if we've got all our teeth and we're just losing wisdom teeth, then there isn't really an urgent need to replace that wisdom tooth with an implant. If you've had that discussion with your dentist and it's something that makes you feel better about filling that gap that is all the way at the back, then again, within 2-3 months, put an implant. But if you've got all your other 28 teeth, then there's no urgent need to be placing a dental implant.
So, Doc, and the next question is that question reads as like this: I did a root canal a year back, and there was a few part of the tooth which was still left. The doctor said to keep the tooth as is, not to remove after the decay. The doctor asked that at some stage I may have to put the crown because it was not covered under the policy. I let it like that. It was not harming because the filling was there intact. But now part of the tooth has chipped off and the some part of the tooth remains inside the gum. And so what should I do next?
Obviously, I mean, without actually looking at the state of the tooth now, it would be hard to answer that question. But generally speaking, if you do a root canal, the tooth becomes the reason you've had a root canal done is because you've had an infection. The chances are you had a lot of decay in that tooth, so the tooth has become weak. You do a root canal, the tooth then becomes quite brittle, so it can break quite easily. That's why we recommend that you put a crown on top. Now, if you didn't do a crown and the tooth just had a filling and it broke off, then the dentist needs to assess what's left of the tooth and whether the tooth has broke off well below the gum or is above the gum. Basically, we need to assess restorability of the tooth. Can we actually put something on the tooth? If you can, then I would definitely recommend a crown because it sounds like the tooth has lost a lot of structure. In some cases, unfortunately, the tooth breaks really badly in a way that there's nothing you can do and the tooth needs to be removed. So it's very important that once you do a root canal that you think about putting a crown on top. Veena, maybe one more because I do have patients now waiting, so if that's okay.
Yeah, sure, no problem. Yeah. So most of the questions we have already answered. There are a few questions like, is this session recorded? Yes, you may want to click on the same link to attend the session again. So last question, Doc, my teeth shakes a bit. Is it common? Also, my gums are receding, even though slowly.
Right, so shaken teeth is not normal. That means there's no bone. The bone around the teeth is reduced, and if the lady is complaining or of also gum recession, the chances are that makes sense. You know, gum recession, the gum has dropped because the bone has dropped to an extent that actually made the teeth loose as well. So it sounds like she's probably got some maybe severe gum problems and bone loss around the teeth. So definitely something that needs to be checked. Sometimes the teeth become loose because there's a trauma to the tooth. If a filling maybe or a restoration that was done on the tooth and it's left high, then and the forces of the chewing is really mainly on that tooth, that can cause the ligaments that hold the tooth to the bone to be stretched, and the tooth then can feel loose. But that's usually then sorted out once the restoration is fixed. But if the teeth are generally loose, then that suggests that there's some bigger problems in there. So I'll definitely recommend a dentist visit in this case.
Understood. Thank you so much for your time, Doc. We have
Thank you.
covered almost all the questions.
Thank you.
It was a very informative session. Thanks everyone for joining this session. Thank you. Have a nice day.
Thank you. Thank you.